Hello, my name is Dr. Abigail. I'm a clinical psychologist. I get lots of people phoning up and saying, I'd really like to have some sessions with you, but how many sessions might I need? So I thought I'd do a video just to introduce, how I think about this with regards to the number of sessions. I look at it as 3 levels of intervention, different intervention. Now, the first level of intervention, as they'd use in the NHS, is maybe a counselling intervention or a life coaching intervention. It's a really safe space to explore how you feel about a particular issue, talk around it, look at different perspectives, and maybe come up with a different way of looking at things. This comes from Carl Rogers, who said that if as a counsellor you could give somebody a good environment of positive regard, they will be able to find their own solutions. These sorts of counselling sessions, they tend to take about 5 or 6 sessions, and it's really a chance to just explore how you feel about something. Now, they're good if you have an issue, a particular situation that's maybe a new situation. So say, for example, there's difficulty with a colleague. And one of the things that might come out of that is that maybe you need to look at things differently and think about things differently. Very, very useful. About 5 or 6 sessions, and 6 is what they'd normally allocate in the NHS to this kind of intervention. The next kind of intervention, which in the NHS would be seen as the next level up, would be more psychotherapy or maybe CBT. So rather than just going, okay, maybe you need to think differently, we're looking at, well, what's getting in the way of you thinking differently? What maybe stuck beliefs have you got that you're holding on to? What things are more on an unconscious level are keeping you in this particular pattern of being? If you were going to have a CBT intervention for depression, for example, it's about 12 to 18 sessions. The research shows can be really effective. So you're looking at more of a solid amount of sessions with this, and CBT and psychotherapy will often go deeper into your background and understand, well, what made you think about life in this way. I would say that you'd be looking at having a good 10 sessions to really kind of get going with looking what's coming up from your background. So the third level of intervention, maybe you've done CBT, well, you've done the first level, you're trying to think differently, that hasn't been enough. So you do CBT or psychotherapy and you look at your unconscious and your drivers, and that's still not enough. You know you need to change, but you can't seem to break out of these patterns. That's when the third level comes in, clinical psychology. It's a bit of a combination of the two, but one of the things we might look at is trauma and having unprocessed difficult experiences in your past, deeper ingrained patterns that are holding you back from changing, that are making your brain the way it is. We do different things like EMDR, which is looking at eye movements and activating trauma memories to dampen their effect on your present life. We looked at compassion focused therapy, which is how your brain is formed as a child with regard to soothing and activating the threat system. We go right back to ground zero and we look at how have you become this way, and we actually look at direct strategies to be different. So that does take a longer time. Again, I'd like to think that you'd like to see some changes in around 10 or 11 sessions, but for those kind of longer term issues, you're probably looking at about 18, 20, 30 sessions. So I'd be thinking about how long has your difficulty been going on for? Have you been generally fine and then you've just kind of hit a little bit of roadblock? That's more of the kind of counselling. Is it something that we can challenge your thinking, reconstruct your thinking, and that will be enough for you? Okay, that's maybe 12 to 18 sessions. Or is this a way of being, the way your personality is formed, that can be changed, and new behaviours and new ways of dealing with emotions can be learned? That's fantastic, but we're probably looking more at about 6 months to a year. An analogy that I would also look at with regard to this is, imagine you go to the physio and you say, oh, my back hurts. So the first level of intervention, they might look at you and say, okay, we've examined you and I can see that you're not walking right, your gait isn't right. So they give you some handouts and some advice about walking differently. So that would be like the first level. The second level of intervention is they might look at your body and say, well, you've got some muscles that are a bit tight, and they do some massage, releases them. And for some people that's enough, and then they can walk straight and their back doesn't hurt. But again, for another level of people, they need something deeper. Those first 2 interventions haven't worked. So they need MRI scans. How is the body formed? How are the bones formed? How are the muscles interacting? And how are the nerves and what's happening with the nervous system? And the physio then would go much deeper, much more intense work for longer term to change the way the body's working to get the person to have a good posture. So again, that's like that with psychology and therapy. There's a sort of 3 levels, and often it's an assessment. You might know yourself from listening to this video, or it could be coming along and having a 1 or 2 session assessment where we might say, okay, this sounds like we'll probably need this many sessions, and we draw on research to make that conclusion. If you like this video, please give us a thumbs up or subscribe. I'm trying to do a video every week. We'll see how that goes. My name is Dr. Abigail. I'm a clinical psychologist and I'm the clinical director of Malvern Hills Private Practice in Worcestershire. Thank you.